it. Only 10% people are getting it. That means if one person in the family acquires H1N1 and there are 10 people living in that family, only one will get it. 9 may not get it at all. जबकि पहले बोला जाता था कि अगर आपको H1N1 के क्लोज कॉन्टैक्ट में आए आपको होगा ही. That means there is some partial immunity or people are getting subclinical infections. It's a mild disease. It's not a severe disease. It has low mortality, lower than conventional seasonal flu. Simple mask is as effective. They came and havoc. H1N1, N95 mask खरीदिए. N95 mask 30 रुपए का बाजार में 200 रुपए का आ गया. So simple mask is as effective as N95 mask. There are defined treatment guidelines. Unless patient is having respiratory distress or pneumonia, don't admit. No testing is required. Treat them like a normal seasonal flu. One good thing happened was Tamiflu was introduced in India, which was not available. It will be good for seasonal influenza also, because a lot of patients with seasonal influenza were dying because Tamiflu was not available. The last point I want to raise is the point flu versus MDR TB. Can anybody sitting here tell me what is the difference between MDR TB and flu in terms of spreading of infection? Anybody? Yes. The size of the flu droplet is bigger. The virus is heavier. अगर आप खांसी करोगे, वायरस जमीन में जाके बैठ जाएगा. So therefore, it cannot spread the disease. MDR tuberculosis bacteria, the size of the virus is smaller. The size of the virus is smaller. The particle is lighter. The particle is lighter. What will happen? It will persist in the air. If it will persist in the air, transmission will be much more. The transmission will be much more. MDR tuberculosis is much more of a concern to our country than H1N1. But MDR has not become a havoc because it is not happening in US. अगर यही MDR के 10 केसेस US में हो जाएं, H1N1 जितना पैनिक हो जाता. So I think all of us as doctors, we need to understand that we need to understand spread of infection, MDR, much more than H1N1. I was reading a study yesterday, and they said, if you want to travel, and H1N1 fits into that, if the flight is less than 4 hours, and if you're sitting in a first class cabin, your chances of getting H1N1 are practically nil. But if your flight is more than 4 hours, then anybody will be, chances of getting infection will be higher. In business class, it will be in between economy class and the first class. What is the difference? The difference of 3 feet. Wherever you are sitting, if the distance between two people is more than 3 feet, the chances of transmission will be lower. And that's what happens in the first class cabin of plane or the newer cinema halls, where the seats are at a distance. If the distance is more than 3 feet, you are not going to get H1N1. The second disease which came like an havoc was dengue hemorrhagic fever this year. Dengue hemorrhagic fever this year. It came with hepatopathy. Everybody developed subclinical hepatopathy. Raised SGOT, SGPT, SGOT more than SGPT, normal bilirubin. Patients had platelet count of less than 10,000. It created a platelet mania. But the mortality was lower. The infection lasted after Diwali, unusual. So there was something unusual about dengue hemorrhagic fever this year. Why we are talking it? Because this may again come this year. The lessons learned are that even if the platelet count is lower than 10,000, don't panic. Unless there is a bleeding, don't panic. There are a couple of new regulations came in HIV in the year 2009. The new guideline said, earlier it was thought, when the CD4 count drops to lower than 200, starts ART. They have revised the guidelines, and now they are saying, if the CD4 count is lower than 350, starts ART. This is a new change in the year 2009, new guideline. 2 weeks back, a new regulation has come from Medical Council of India. Are you all aware of that? The new ethics, the new code of conduct has been published by Medical Council of India, and that is regarding doctor-pharma relationship. Doctors cannot accept gifts. They cannot accept travel grants. They cannot accept holiday trips. They cannot accept CME tuition fee. अभी तक क्या होता था, आप कॉन्फ्रेंस में जाते हो, आपने फिजिशियंस की कॉन्फ्रेंस अटेंड करनी है, फार्मास्यूटिकल कंपनियां आपका ट्रैवल, आपकी फीस, आपका रजिस्ट्रेशन, आपका होटल स्टे, आपको कार सब देती थी. That has been prohibited from this year. This is a new Medical Council of India regulation which came 2 weeks back. It has been published, it has been cleared, it is now a gazetted, it comes into the MCI ethics that they have banned, and this movement came after it happened in the US, and within the same year, Medical Council of India adopted it. That means a doctor cannot accept anything directly or indirectly from a pharmaceutical company for the purpose of education. BRMS, Medical Council of India initiated the concept of BRMS, a 3.5 years mini MBBS course. They are supposed to implement it this year. What they have done is they have designated rural areas. They have designated rural areas. In designated rural areas, what they are saying is, anybody who is studying in a designated rural area, who is 12 plus 2, can get a seat in a mini MBBS course called Bachelor of Rural Medicine and Surgery. That person will do a 3 years MBBS, shorter MBBS, and 6 months of internship. He cannot do MD, MS, DM, or MCH. The person cannot go abroad because this degree will not be recognized abroad. It will only be recognized by respective states, and they can only practice in respective rural area. They will not be registered under IMR, but in a separate register. This has created some controversy among the medical profession, and Indian Medical Association is yet to come with this view whether to oppose it or not. But this is something which the medical fraternity should know. Something happened in 2009. The government of Delhi came out with a controversial circular. This is something which the medical fraternity needs to fight. And the controversial circular says that if I call an ultrasoundologist in my center to do ultrasound for my patients, then I have to buy an ultrasound machine. That means the ultrasoundologist cannot carry his ultrasound machines to different centers and do the cases there. The corollary of that is कि अगर मैं के अग्रवाल हूं और मेरे को घर में अल्ट्रासाउंड की जरूरत है और मैं किसी अल्ट्रासाउंडोलॉजिस्ट को बोलूं मेरे घर में आके अल्ट्रासाउंड करो, तो मेरे को अल्ट्रासाउंड की मशीन खरीदनी पड़ेगी, तब जाके मैं उसको अलाउ कर सकता हूं. दैट मीन्स जिस प्लेस में अल्ट्रासाउंड मशीन यूज होगी उस प्लेस में वो जिसका प्लेस है, ही मस्ट ओन एन अल्ट्रासाउंड मशीन. इट्स अ कंट्रोवर्शियल सर्कुलर विच हैज कम फ्रॉम दिल्ली गवर्नमेंट. I think this is something where we need to debate and we need to fight about it. We don't know why government has come out with a, I'll